Did you know that 1 in 3 people who suffer a mini-stroke will go on to experience a major, often disabling or fatal stroke? Each year, more than 240,000 Americans have a mini-stroke called a Transient Ischemic Attack, or TIA. Yet most never know it happened. These silent strokes can last just minutes, but they are your brain's urgent cry for help, its final warning before something far more dangerous occurs. The tragedy? Up to 80% of strokes are preventable if the warning signs are recognized and addressed in time. In this video, we'll walk you through 8 critical signs of a mini-stroke that seniors and their families must never ignore. Recognizing these signs could be the difference between life, death, or lifelong disability. What is a mini-stroke? A mini-stroke, or Transient Ischemic Attack, TIA, occurs when a blood vessel temporarily blocks blood flow to part of the brain. The symptoms often mimic those of a full stroke. Sudden numbness, slurred speech, vision loss, but usually fade within minutes or hours. That's what makes them so dangerous. They're easy to dismiss, but the risk of a major stroke is highest within the first 48 hours after a TIA. A mini-stroke is not a false alarm, it's a final warning. Immediate medical evaluation is critical. 8 warning signs of a mini-stroke in seniors. Number 1, sudden weakness or numbness on one side. Sudden weakness or numbness in the face, arm, or leg, especially on one side, is a hallmark symptom of stroke. This occurs because each side of the brain controls the opposite side of the body. Look for facial drooping, a heavy arm, or a hand that can't hold an object. If one arm drifts downward when both are raised, seek emergency help fast. Even if these symptoms resolve quickly, they suggest a temporary brain attack. Don't wait, act immediately. Number 2, dizziness or loss of balance. Feeling like the room is spinning or having sudden difficulty walking may signal a TIA affecting the cerebellum or brainstem. This isn't regular vertigo. There's no trigger, just a sudden, alarming loss of control. If walking becomes unsteady or you feel off balance for no reason, especially if accompanied by nausea or confusion, treat it as a medical emergency. Number 3, vision changes or sudden loss. Mini-strokes can cause brief but serious changes in vision. You might see double, lose sight in one eye, or experience a curtain-like shadow. This is known as amaurosis fugax, or hemianopia, often mistaken for migraines or eye strain. The key difference? Stroke-related vision changes are abrupt, one-sided, and painless. If you experience sudden vision changes, no matter how brief, get emergency care immediately. Number 4, sudden severe headache. A thunderclap headache. Sudden, intense, and like no headache you've had before, may be your brain's early warning of stroke. This pain often comes with nausea, sensitivity to light, and no relief from painkillers. If a headache strikes out of nowhere with peak intensity in seconds, don't wait. Call for emergency help. It could indicate dangerous changes in brain blood vessels. Number 5, tingling or pins and needles sensation. Unexpected tingling or numbness, especially on one side of the body, may be due to disrupted blood flow to your brain's sensory processing areas. Unlike typical limb falling asleep, this sensation appears suddenly and isn't relieved by movement. Whether it's a crawling feeling or temperature change without a cause, don't ignore it. It's not a nerve issue, it's a brain issue. Number 6, brief loss of consciousness or graying out. Sudden fainting or near-fainting spells, often described as graying out, can signal a TIA. These episodes occur when the brain's alertness center loses oxygen briefly. You might feel lightheaded or disoriented after regaining awareness. These events are often mistaken for fatigue or low blood sugar, but could be neurological red flags. Always get checked. Number 7, slurred speech or trouble speaking. If your speech suddenly becomes slurred or hard to understand, it's a major warning sign. This condition, called aphasia, means you may have trouble speaking, understanding, or forming words. You might know what you want to say but can't get the words out. If you or a loved one experiences this, call emergency services immediately. The brain's language center is under attack. Number 8, sudden confusion or mental fog. Sudden confusion, disorientation, or an inability to perform familiar tasks may appear subtle, but it's one of the most overlooked mini-stroke symptoms. Unlike dementia, which progresses slowly, TIA-related confusion is abrupt. If someone suddenly forgets where they are, struggles to speak, or seems mentally disconnected, take it seriously. The brain is calling for urgent help. What to do if you notice these signs? If you or someone else experiences any of these symptoms, even if they disappear within minutes, do not delay. Call emergency services immediately. Do not drive yourself. Remember, every minute counts. Mini-strokes are your brain's last warning. Acting quickly could prevent paralysis, memory loss, or death. Stroke prevention tips. While we can't prevent every stroke, up to 80% are avoidable with lifestyle changes. Eat a heart-healthy diet, for example, Mediterranean style. Stay physically active. Daily walks matter. Manage blood pressure, cholesterol, and blood sugar. Quit smoking! Limit alcohol. Take medications as prescribed. Follow up with a neurologist if you've had TIA symptoms. Small steps today protect your brain tomorrow. Mini strokes may be brief, but their consequences are anything but. Don't ignore the signs, recognize them. Respond quickly. If this video helped you, please share it with friends and family. Comment below if you or someone you know has experienced stroke symptoms. Your story could save a life. Subscribe for more doctor-reviewed health education, because your brain deserves urgent care, and every second matters.